If you've ever stood at a pharmacy counter and wondered why your prescription costs hundreds of dollars here in the United States, while the exact same medication costs a fraction of that in other countries, you're not alone. So why does this happen? Today, we're breaking down the real reasons behind high U.S. drug prices in simple, clear terms. 1. Patent protections. One of the biggest drivers of high drug prices is patent protection. When a pharmaceutical company develops a new medication, it receives a patent typically lasting about 20 years. During that time, no other company can legally produce a generic version. That lack of competition allows the manufacturer to set the price without market pressure to lower it. On top of that, companies can sometimes extend exclusivity through additional patents for slight formula changes, delivery systems, or new approved uses. This practice delays generic competition even longer. The longer the exclusivity, the longer higher prices can remain in place. 2. Limited government negotiation. Another major factor is negotiation, or rather, the lack of centralized negotiation. In countries like Canada or the United Kingdom, national health systems negotiate directly with pharmaceutical manufacturers. Because they represent the entire population, they have strong bargaining power. If the price is too high, they can refuse coverage. That pressure drives prices down. In contrast, the United States does not negotiate drug prices across the board at the federal level in the same way. While recent policy changes are beginning to introduce limited negotiation in certain programs, the system remains largely fragmented, and fragmentation weakens bargaining power. 3. A complex supply chain. Drug pricing in the U.S. also involves multiple players. There are manufacturers, wholesalers, pharmacy benefit managers, often called PBMs, insurance companies, and retail pharmacies. Each layer negotiates rebates, sets pricing formulas, and adds administrative costs. The result? The final price at the pharmacy counter can look very different from the original manufacturing cost. This complexity makes the system harder to navigate and often less transparent for patients. 4. Market-based pricing. Unlike countries with regulated pricing systems, the U.S. largely relies on a market-based model. Manufacturers often set launch prices based on what the market will bear, not necessarily based on production cost. That strategy can lead to significantly higher list prices compared to other developed nations. Understanding how the system works doesn't instantly lower prices, but it does empower you. If you're facing high prescription costs, talk to your healthcare provider about generic options, therapeutic alternatives, or patient assistance programs. Being informed helps you make better decisions about your care.